Budget 2022 was introduced last week and set out the federal government's spending priorities. Among other things, the federal government highlighted mental health. Budget 2022 proposes providing $140 million over 2 years to Health Canada for the Wellness Together Canada portal, while providing continued support from the previous budget. It also pledges $100 million over 3 years for addiction support. With us to discuss how the budget addressed mental health in Canada is Sarah Kennell, National Director of Policy at the Canadian Mental Health Association. Ms. Kennell, how are you?
Good, thank you. How are you?
Great, thank you for being here. Let's take a look, big picture. How did Budget 2022 address mental health needs in Canada?
Well, taking stock of the budget in its entirety, as you mentioned, we saw investments in the Wellness Together and Pocket Well app, so a virtual mental health providing service that's being offered to Canadians across the country. We also saw increased investment in the Health Canada Substance Use and Addiction Program and some other initiatives that seek to address populations that have been disproportionately impacted by the pandemic from a mental health perspective. All good things. However, what we didn't see is a rollout plan for the promised Canada mental health transfer, and that, in our opinion, is a missed opportunity.
Well, it's interesting there, missed opportunities in every budget, it seems. Along with the COVID-19 pandemic, communities across the country have been reeling from opioid-related overdoses and deaths. So I know it was mentioned in the budget, there was a special line on opioids. How does it address addictions and addictions needs in Canada?
Yeah, well, what we know is that community-based interventions to address problematic substance use and the opioid crisis are really critically needed. And there's an opportunity in this budget through the Substance Use and Addiction Program to scale up those types of interventions. So we're really happy to see that. At the same time, we do need to see greater federal leadership, when it comes to safe supply, safe consumption, and those conversations have yet to really take off. And that's where we need to see investment and political commitment.
Interesting. Now, CMHA's recent study, we've got the title here, Running on Empty, How Community Mental Health Organizations Have Fared on the Front Lines of COVID-19, indicates that community-based mental health addiction services are key to the system. So does the budget address the funding needs at the community level with what you're seeing?
Not nearly enough. What we're seeing really is a rehash of what we've always done, which is fund the public sector, hospitals, psychiatrists, family physicians. We know these are critical components of the mental health system in Canada, but they're not everything. And we know that a lot of people rely on private insurance and paying out of pocket to access services like counseling and psychotherapy. That's where we need to see greater attention paid and increased investment. And until we do that, people are going to experience barriers and access to mental health.
So speaking of the front lines, what about the frontline workers themselves? Does the budget offer any support for these workers, especially as these services have been in such high demand during the pandemic?
Yeah, what we know about community mental health workers is that they're overburdened, they're burnt out, and really they're facing great pay disparity when it comes to the salaries they receive in comparison to their counterparts in hospitals or, the public health system more generally. And so while investments in Budget 2022, like the Foreign Credential Recognition Program and loan forgiveness for doctors and nurses working in rural and remote areas, are incredibly welcome. They aren't, the full picture in terms of the type of investment we need to see. We need to see dedicated attention put towards pay equity and also strategies to reduce the burden placed on the community mental health workforce that has just been tapped out during the pandemic.
And we know, not only workers, but people across the country have really been seeing a lot of, mental health related strain, and that, I believe, a survey with UBC that you did, CMHA as well, 37% of Canadians say that they are struggling with mental health. Where are they going? Where are Canadians going? Where are individuals turning to for support?
Well, we know that through this research, about 10% of the population has turned and relied on virtual mental health services like Wellness Together or a CMHA program called Bounce Back. These are incredibly useful for people experiencing mild to moderate symptoms of stress, anxiety, and depression. However, it isn't going to work for everyone. We know that people with more severe mental illness are going to require in-person care. We know that those seeking care, about 20% of Canadians said that they just weren't able to get the care that they needed during the pandemic, and that's really concerning. And among those who couldn't get care, 30% of them cited not being able to afford the care because they couldn't pay out of pocket to get it. So the research is significant, and the numbers are getting worse.
Wow, incredible. Very important conversation, lots to keep in mind. Ms. Sarah Kennell, thank you for joining us today on Forum Daily.
Thanks for having me.